My name is Emily Beauregard. I'm the Executive Director of Kentucky Voices for Health, and I'm here today with a panel of Kentuckians who are speaking up because Medicaid is under threat. The House voted last Thursday to pass its version of the reconciliation bill, now called the One Big Beautiful Bill Act. While it promises to extend federal tax cuts, this bill will actually do much more to hurt our economy and take away health care from an estimated 200,000 to 350,000 Kentuckians. In reality, it's nothing more than a cost shift to states that Kentuckians frankly cannot afford. Not only would Kentucky lose $1.7 billion in federal funding every year, we would lose thousands of jobs and see the rate of uninsured Kentuckians more than double, putting an enormous strain on a healthcare system that serves all of us. Any tax benefit the average person may get will pale in comparison to the medical debt and loss of health care everyday Kentuckians will experience. The people who will lose coverage will be our friends, our family members, our coworkers, our neighbors, and the people joining me today who are worried it will be themselves or their loved ones who will lose coverage. Every single one of our panelists is working, taking care of themselves and their families, and contributing to their communities in countless ways. With the One Big Beautiful Bill Act now in the hands of the U.S. Senate, we're hosting this discussion to lift up the voices of Kentuckians who will be hurt by Medicaid cuts. And we're asking that Senator McConnell and Senator Paul, along with our representatives in the House, listen closely and choose to take a different approach that makes healthcare accessible and affordable for every Kentuckian. We have 6 of their constituents with us today from each of Kentucky's congressional districts, and I'm going to pass it to Morgan Whiting, KVH's outreach coordinator, to introduce everyone and get us started.
Thank you so much, Emily, and welcome everyone. We appreciate you all being here today. I'm going to share a little housekeeping before we get started with our conversation. First, just please keep your lines muted and place any comments or questions in the chat. We plan to address any media or audience questions at the end of this panel discussion, and we will share a link to the recording and a follow-up email. So with that being said, I am excited to introduce you to today's panel. I'm going to let each of them introduce themselves and share a bit about who they are and how Medicaid has impacted their lives. And we're going to start with Aisha. So Aisha, I'll hand it to you.
Hello, my name's Aisha Elam. I am in the 5th District in Boyd County. I am a case manager at Ramey E-Step Regroup. I 1 semester away from my master's degree at the University of Kentucky. I first started utilizing Medicaid whenever I was a child. I grew up using the program. And then as I had my own children, I utilized it then. And it's also been critical in my journey to recovery. I used it for medically assisted treatment. And now I see it being used every day as my work as a case manager at a substance use disorder treatment facility.
Thank you so much, Aisha. I appreciate you being here today. Our next panelist is going to be Theta. Theta, I will let you introduce yourself.
Hello, everyone. My name's Theta Mosby. I am a birth parent advocate in the state of Kentucky and nationally. My son was removed from my home during COVID in 2021. He was never reunified with me. The system, any family that's been system impacted understands the importance of Medicaid. It was a driving factor in there not being a grief counselor anywhere near my location at the time when my husband had passed away, and my involvement began with DCBS. So it's critical to me that we're here today, that we're going to discuss this, that we're going to get this information out to everyone. So I'm just glad to be here today. Thank you all.
Great, Theta. Thank you so much. Keith, can I have you introduce yourself?
Sure. My name is Keith Farah. I'm the Regional Director of Operations for the state of Kentucky for Pinnacle Treatment Centers. We operate 4 substance use disorder treatment sites in our state. I have a master's degree as well, and am a licensed clinician in the state of Kentucky. I only mention those things because honestly, anybody could get there and do those things if they just follow the right guidance. That's not where it started for me. I was homeless 12 years ago. I've been sober for 12 years now and engaged in recovery. I had Medicaid when I got sober, as well as hepatitis C. So it's a good thing I had both those things at the same time. Um, had I not received treatment, um, there are a lot of people in the state of Kentucky who I've been able to impact along the way who would tell you that it would have been a disservice to them and to the population I get to serve, especially based on my lived experience. So grateful to be here, always happy to give back. Um, and, I think all of us have a degree of privilege to one way or another, and really happy that I get to use that to serve.
Awesome. Thanks, Keith. And we're excited
Sure.
you're here. All right, Katie, I'm going to pass it to you to introduce yourself.
Hi, I'm Katie Newspickle. I'm the Health and Safety Coordinator for Head Start, and I am also a foster parent. So the way that I kind of fit in here is I have to find services that are available for children with their Medicaid plans and try to find what help is out there. There are definitely some barriers now. I can only imagine, once this goes in effect and if there's cuts, what kind of services that our Head Start children are going to get. And then being a foster parent, just trying to find services in Northern Kentucky that, when I call a provider and that provider's like, sorry, we've already reached our max of Medicaid patients. And I can just imagine what it's going to be like once the cuts go in effect and if there's going to be anywhere for even the foster kids to go, because it is difficult trying to find care.
Absolutely. Thank you, Katie. Excited to hear from you today. Tanya, I'll pass it to you.
So I'm Tanya Whitfield, also Morgan's sister. Blood couldn't make us any closer. And so I am from Chicago till I die. I always have to say that. Kentucky is where I live, so I'm always gonna fight for wherever I live because I am a mom. I am a community leader. I work for a few organizations, so I'm not gonna just say one because I don't want to put nobody more special than another. But I will say that, I am honored to just be here because I just know where I've been and where I'm going. And even though I'm not where I want to be, I'm grateful I'm not where I used to be. And just for KVH to even have this platform for us to even just share our experiences and to see the value of that is just such an honor and a privilege to be here.
Well, we are honored to. Tanya, thank you. All right. And last but surely not least, Rayana, can you introduce yourself, please?
Thank you so much. I'm Dr. Rayanna Flemons, and I'm from District 2. I am the mother of a 19-year-old who has Down syndrome and autism. He also is nonverbal and receives Medicaid services through the Michelle P. waiver that he gets through the state. He's a very active young man and keeps me extremely busy. My husband and I both work full times. I am involved with lots of advocacy, nonprofits, and I'm excited to share our story and thoughts with you today about the Medicaid program.
Thank you so much. Thank you all for joining us and just jumping in and being willing to be here today. We're just excited to have the stories of folks from each of our 6 districts represented and be able to really shine and highlight what these impacts are truly going to look like for all of Kentuckians. So I'm going to go ahead and just jump right into it. And I'm going to start with you, Keith. I wanted to, if you wouldn't mind talking a little bit more about how Medicaid policies and restrictions can impact the care for those with hepatitis C and accessing care, long-term care and support as through recovery. So I was wondering if you could talk a little bit more about what that looks like.
Sure. So due to the prevalence, especially in our state now, of IV use, there's certainly a lot more Hep C cases than there might have been 10, 12 years ago when I entered recovery. I know for me personally, it was a subtle negotiation of my humanity having to be the person on the sidelines watching a provider and a payer go back and forth as to how sick I was and if I actually deserved treatment yet. And while I wouldn't want anyone to experience that, at least I was able to get treatment at a minimal amount, actually, versus what was therapeutically indicated for the degree of my illness. Um, so even with Medicaid, there's already that barrier because hepatitis C treatment is very expensive. Um, and we're seeing more and more cases. The good news in our state is that overdoses have gone down. But that's not to say that any of the associated illnesses of substance use disorder have minimized at all. And I think one thing that is, I think we talked about this earlier too. One thing that's kind of standard in our country is treating symptoms versus illness. And I think a lot of our payers look at that as let's continue to treat the symptoms of this person's disorder versus hepatitis C itself. So I say all that to say it's already difficult enough, and I can't imagine what it would look like for thousands of people not to have access to that treatment. As I've mentioned before, there are, I think it's safe to say, at least, there are a lot of people in my life who would tell you they're very grateful that I did have access to treatment, access to health. And it's such a slippery territory that we put marginalized communities in a position to have to justify and to have to explain why they deserve health care as much as anyone else. So I feel that any further elimination of access to what should be a right for all of us feels real terrifying for me. These are mothers and fathers and sons and daughters, and you shouldn't even have to put it that way. They're human beings, really. So you should not have to humanize a human by giving them a colloquial label. But nevertheless, that's kind of, sadly, that's what works, it seems like. In terms of the population I serve, which is those with substance use disorder, it's already so challenging. A lot of our payers are looking for reasons to deny patients, and it's them accessing true medical help given the acuity of their symptoms is already challenging enough. It gets more and more difficult. And again, in a landscape where it's already challenging, like right now, I can't imagine what it would be like if 200,000 or 300,000 people in our state lost access to life-saving treatment. And so I already see them struggle already. And I can't imagine one more barrier being put in place, and kind of what that would look like. And it grows arms and legs so quickly because not only is it challenging for people to get help, but there will be treatment facilities that literally go out of business if this happens. Like, it's important to note that they're already barely making it as it is right now. So not only are we not serving a population, but now you have the potential of hundreds of people not being employed. And some of these facilities are in the rural parts of our state where they can't just go down the street. Like, I live in Louisville, Kentucky, and I didn't put my district in there earlier because I knew I would mess that up, actually. So yeah, sorry. I'm in Morgan McGarvey's district, whichever one that is. And so, like, people are going to lose jobs. People won't be able to support their families. Like, gosh, man, it grows arms and legs so quickly. And it's always the populations that need it the most who suffer, it seems. So I think that's all I have, because I'll keep talking. So I need you all to tell me to
I mean, no, I think that's great because
Sorry.
really, you're good. I think a lot of what everyone is going to be talking about today is just how this is increased barriers for folks, right? People who are already experiencing a lot of other barriers, a lot of other systems that they're having to engage to get their, needs met. So I think um, just highlighting how that's going to continue to impact a community of people who already are working 3, 4 jobs, and now there's additional, work and paperwork and things like that that are going to have to be done. So, I think that I appreciate it. Thank you for sharing, really what that's going to look like for folks who have similar experiences to you and for the folks that you work with. And it's actually a really great transition, Aisha, because I wanted to ask you to talk a little bit about, with your experience with and expertise with houselessness and with substance use disorder, and kind of to what Keith was saying, there's already a lot that folks are experiencing and having to do, just to get by. And so, what do these added um, layers, such as the mandatory work requirements or the mandatory copays when people already don't have money to eat? What kind of impacts will that have on the folks that you work with and that you know?
Yeah, so I mean, that looks like having to choose between medical services and literally eating. Um, so in my experience, being homeless, um, I mean, every day is you're trying to survive for that day. And when you place a barrier like a copay to getting medical treatment, it's just not going to happen. Especially if it is somebody who's dealing also with a substance use disorder. And not every person who is experiencing homelessness is experiencing a substance use disorder, but a lot of the times it goes hand in hand. Um, and there are so many people, there's so many Kentuckians who, there was one study that said something like 9.5% of Medicaid recipients used at least one substance use disorder service in 2020, I think it was. Um, and so that's a lot of people that are utilizing those services. For me, there was a point in my recovery when I utilized MAT, medically assisted treatment, and I remember when that became available. Before you could use Medicaid to help pay for that. It was almost impossible to get those services. It was very expensive, and then there's all kinds of other requirements. And I remember how life-changing it was to be able to use Medicaid to receive those services. And I know a lot of people that it's still life-saving for them. As Keith already mentioned, it's already very difficult in this field. We're fighting for days. We are literally fighting every week for our clients to get more time in the treatment that they need. So we're expecting these people to come in, off of the street from years of substance use, and then we're telling them, well, you've been here 7 days, you can go ahead and go to the next level of care, or you've been here 14 days, it's time for you to go home, and then we act surprised when they return to use. We've seen a decrease in overdose deaths the last 3 years. However, that was due to increases in access, to services, increased funding and resources, expanded naloxone distribution, and these cuts are actually uh, doing the exact opposite. Would actually do the exact opposite. So we're going to be cutting funding for these and programs. So it looks like more overdoses. It looks like more Kentuckians dying due to substance use disorder. And I just want to highlight the seriousness of uh, how people are actually using these services, are actually using Medicaid to save their lives. I feel like it can't be, like, we can't overstate that. As far as the new work requirements, yeah, those are definitely going to cause more of a barrier. I believe they're also going to increase the frequency of the redetermination. So not only are we going to have more requirements, but we're going to have to do it more often. So that's transportation, that's getting to the place. If you're in a rural area and don't have access to transportation, that's a barrier in itself. And so it's just more people at risk for losing their benefits. And when you're experiencing homelessness, you're already in an increased risk for other, physical health ailments. And so we're just perpetuating cycles at this point. Um, and so I feel like it just looks like regression. If we lose these services, if we lose this, if these cuts happen, we're just going to, I think, move backwards.
Right, right. I was just gonna say that, like taking steps back from, where we have come, and we still have a lot of work to do, but are we are again, you're really highlighting that the unneeded paperwork and the red tape for those who are already jumping through hoops to get their basic needs met, and it's not helpful. And really, another thing I hear is like people are going to fall through the cracks, right? So one thing I think you and Keith, thank you, Aisha, for sharing. One thing you and Keith also kind of named was that we're talking about people, right? And so in that vein of talking about people, Tanya, I want to shift to you because you're a mom, and you are a mom to two beautiful, as you call them, princesses. And I was hoping you could speak a little to what are these cuts going to mean to you, to your family, and to you as someone who's really rooted in community. What's it going to mean for your community?
Man, I tell you that one, I'm already like fighting back tears. Because like this is really gonna hurt. Like seriously, like this ain't just because we're just having a fun conversation. Like this is real. Like right now I am like coughing like crazy. Thankfully, I'm not coughing as I'm talking. But I have specialists that I go to, and how I'm able to do that because I've had great doctors that see the need that will fight on my behalf, to help and make sure that I'm good because I cannot pour from an empty cup. And if I'm not good, I can't be there for my daughters. I can't. There's no way. And that's why they always say, like, you got to put the oxygen mask on you before you put it on your kids. Because by the time you try to put it on your kids, y'all all dead. And I know people be scared to answer that question because they be thinking, oh, then it's going to make me look selfish if I say me first. No, self-care is not selfish. And that's what it's going to look like. Like when I look at my neighborhood, I see all these hardworking families. I see a lot of grandparents that and not to knock foster care because there are some great foster care out there, but there are some not so great either. So it's on both sides, right? And a lot of them are keeping their grandkids so they don't end up in the system. And it's a lot. It's a lot. That's what I'll say about that.
Thank you, Tanya. Um, I think as you're alluding to, being a parent's already difficult, right? And then you have to make all these with cuts and having money taken out of your pocket, you're having to make hard decisions for you and your family and having to decide whether or not you take your kid to the doctor. That's not a decision any parent should have to make, right? I know that's not a decision you ever will or want to make for your kids. So I appreciate you speaking to just what it looks like and to your community. These are hardworking people, right? So thank you, Tanya. I appreciate it. And kind of a great transition into talking to Katie, who is a foster parent and also works with Head Start and supports children birth age to 5 and accessing Medicaid. And I was hoping, Katie, you could talk a little bit about what it's like navigating already confusing system, just to get, needs met for the folks that you serve and as a foster parent, and what these creative barriers are going to look like, for those services and for the services you're providing as a foster parent as well.
Sure. Navigating is quite an adventure. But the great thing is I do this every day, for kids birth to 5, and I have to find providers that take their insurance. Some of the barriers that I'm running into currently, not foster care wise, but like the MCOs, it just depends on what MCO you have. But for example, like Aetna or WellCare, I called 5 providers. Each one of those said on the website that they take it. I called out of those 3 providers, actually, I called all 5, and only one of those providers were taking Medicaid patients at the time. So what they do is they max out and they say, okay, we're taking a top of, I don't even know, I'm just going to give you a crazy number. So we're going to take 200 Medicaid patients and we're topping out and we're not taking any more at our practice. That's what happens. So then that leaves the parent at only going to the one practice. So sometimes what else can happen is, like, we have requirements to meet here just for Head Start. They have to have that within a certain time frame. And some of those appointments are not met, like dental, sometimes vision. It just depends on the provider. For 6 months, over 6 months, they can't get the appointment because they're so backed up, because that's the only Medicaid provider still accepting patients. So that's kind of what we're seeing, like dental wise is the big one. So just the care that's available. But if this gets cut, is that going to be cut to where, my worry is, we said something about hours and how many hours the parent has to work. So that's my other thing. Kids shouldn't be punished. Kids should get it because they're kids. We need to make sure they're getting care, so that, because they're going to be in our economy. They're going to be the ones servicing us one day when we're old people and we can't take care of ourselves anymore, So we need to make sure those kids are taken care of and they're getting the care they need when they're young. But then as a foster parent, I called around to providers trying to get them in because they're older children, they're teens. And that's a whole nother barrier, because all the providers that I work with, guess what? They do not take teens. So there's only a few providers in Northern Kentucky, again, for dental. So, I mean, again, if services are cut, does that mean providers are going to be cut off this list? Does it mean that, is there going to be some stipulations put on those providers, of how many they can accept or how many are going to be out there? Because the funding, I know, is going to be limited. So does that mean they only give a certain amount? Because parents, when they don't have money, they cannot drive all the way to Georgetown, and then it cannot drive all the way to Lexington, from Northern Kentucky. That's like a 2-hour drive for us. So that's too far to ask a parent to drive when their car's halfway broken down, if we're going to get rid of services for a ride to get there. Because I have several parents that actually use, like, we'll pay for a cab if we can't get them one or their insurance will not provide one. So we'll provide one for them for Head Start. But if you're a typical parent, you're working, and you need that to get your kid to the doctor, because you take a bus everywhere. And let's say that, I live in the country, and there's country up here in Northern Kentucky, there's a little bit of city, but some of those people that live out in the rural communities can't get from A to B. So we have to rely on transportation for them. Or even if you're in the city and you take a bus, but that provider might be all the way, 45 minutes away, and you can't get there on a bus. It's not going to happen. So just the accessibility, that could be taken for those kids to make sure that they have what they need. Foster parent wise, everything is there. The services are great. I have a teen that's going to be 18. He's entering his senior year. And the insurance has really been awesome, because it's Aetna, the Sky program and everything. They even service us. They call, they make sure the kids are getting what they need. I do like the wraparound service. I know that's Sky for foster care, but would that be cut? Would that be like, servicing his needs for, when he's about ready to enter adulthood, and, they're giving them some supplies for college and just little things you can do to get on that next step and next level, because some kids, like you said, foster homes, like some of them are wonderful and some of them are not. So, it depends on the home they get, which is a standard thing. You have to follow stuff, but some of that Medicaid really does help the kids set up for the next level. Like, is that going to be cut? Like, he is going to be able to be covered by his insurance with Medicaid right now until I think it's 21 or 26, might be 26 for Medicaid. But he gets to be covered on that because he's going to choose to continue and re-opt to be into the program. But just services like that, is that going to be covered for him? I mean, he's taken an opportunity, he's going to go to college. A lot of students that are in foster care don't choose to go to that next step. And yeah, they'll be out on their own, they'll be working, things like that. But just to give them that extra help along the way to make sure that their needs are met and they don't have to worry about that extra piece. And then let me see. So just back to foster, or back to Head Start. Also with the other services and the barriers that we're seeing is like the behavioral stuff for children. So I've been a health and safety coordinator for 13 years here at Head Start. And just within the last probably 4 or 5 years is the most behaviors that I've seen. We're seeing a lot of autism being diagnosed. We have several children that's in the middle of being diagnosed. We also have, more ADHD that's more diagnosed now than it ever has been. And I'm not just saying like, oh, the doctors are just over prescribing. They're not. We have some severe behaviors. So we have to refer those children to Cincinnati Children's. And guess what? Cincinnati Children's don't take that insurance. They don't take Medicaid. So that's a barrier. So then we have to hire an outside agency to come in and give services for some of those, like OT, PT, and we hire them and pay out of Head Start's pocket because a lot of the Medicaids do not cover that currently. And then some other things, like there is a couple other services that we can refer to for autism in Northern Kentucky, but that again is a wait list. Their Medicaid provider has to make a referral, which is never a problem. They're pretty good about that. But just getting them in and making them wait is the problem because they can't like call them up like, if we have regular insurance and say, okay, I need to get on this list. I know you got to wait a little bit, but I'm talking like a year out. So, and again, we don't want to send parents really far away because we do not want to Band-Aid fix it. We want to make sure that when they move on, to kindergarten from us, we don't want to Band-Aid fix things. We want to make sure that they have care beyond us, and then parents can pick up and make appointments when they need to, so they can self-advocate. Is there any other questions?
No, Katie, that's awesome. You touched on so many different pieces that I was like going in my brain. I was like, yes. So one of the big things that we talk about is how are these cuts going to impact whether or not services are available, whether or not providers are available. And that is something that people are really worried about. We've already kind of, we can see those impacts. And we're going to talk about this in a little bit, especially in our rural communities. So kind of what you touched to. And then another thing that you touched on, which I think is a great transition to us talking to Rihanna, is about how does this look for families who are receiving services for kids who are living with disabilities, and what do these cuts look like for them? And so I do appreciate it. Thank you so much for all that expertise. So as Katie transitioned, Rihanna, this is a great segue to you. You're a caregiver of a child with Down syndrome, as you shared, autism, who's nonverbal. And we know that these Medicaid cuts would result in millions of seniors and people with disabilities, and that it would impact them into struggling really financially, and create more burden especially for family caregivers. So I wanted to ask, how not having access to Medicaid would impact your ability to provide care to your son, and other caregivers in our communities. What could that look like?
Absolutely. Well, one of the things that I have noticed that's been a common theme coming from the federal government is how they will not cut to people with disabilities. And that's been promised over and over and over again. While I hear that, I also hear that they are not making a promise to decrease the amount of red tape that is involved in that, thereby ensuring that people with disabilities have a barrier to receive those services. We can call it a big, beautiful bill. I refer to it as a big, beautiful bill of buck passing because we're passing it on to the state and we're passing it on to the parents. In my case, my husband and I both work. We both work full time, 40 hours a week, both of us. My son requires 24/7 care, and Medicaid helps us provide that because our job doesn't end with our workday. We come home and we have to provide services that our friends who have children with without intellectual disabilities aren't having to provide, from toileting to shaving to being up through the night when our son just can't sleep because we can't leave him alone. That means care. And that means that my husband and I rarely get a break. We just had the one child, and we never get to go out and do anything without Medicaid. So he is part of the waiver program. He receives Medicaid. It is secondary to our primary insurance. That waiver ensures that we can go to work, we can pay for caregivers to provide for his needs, we can go out to dinner once a month, which is a luxury that a lot of our friends are able to do because they have grown children who were born around the same time as Caden, and they can be trusted to be left at home. My son cannot. So we do have to have that care. And an important note about waivers is simply that waivers were created to ensure that individuals like my son could be active within the community and that they would not be put into an institution. So if I had to make the choice today as to whether I was going to continue to work, which I think is a common theme that we hear, we want everybody to work, we want parents to work, we want to make sure nobody's in the system that shouldn't be working. The day I have to make a choice between putting my son in an institution or providing that care is the day that I will quit the workforce. And I think that there are a lot of parents out there who share that same sentiment because we do believe that the home is where an individual should be and not an institution. And it's far easier and cheaper to allow me to pay for care than for the government to have to pay that out of pocket for him to be in a facility receiving that level of care. Paperwork is a huge barrier because I am working. My husband is working. Like the rest of the world, you get 20 minutes to about an hour and maybe 30 minutes if you take your breaks with your lunchtime. So with that in mind, if I have to go to the Medicaid office twice a year for us to have approvals, or better yet, call multiple numbers and pray that I've got the right number because I'm going to be on hold for a very long period of time just to confirm each year that my son still has Down syndrome and autism and is still not talking, then that is a colossal waste of my time. It's a waste of my employer's time, and it is red tape that my son cannot do without me as his guardian at this point. I have to be there. I have to be there for Medicaid. I have to be there for Social Security. I have to be there for medical appointments. So the red tape that's being placed on this is absolutely colossal. And the fact that I have to prove every time that my son still has Down syndrome is offensive because he can't go to work. And anybody who would take him to work would spend more time working with him and probably have a great time, to be perfectly honest, because he would be an absolute joy, but there'd be no work that would go on in that situation. Even though we have completed K-12 school, we've done all of the transition programs that are out there, that programs like vocational rehab help fund through the support services, through the Michelle P. waiver. We've done all of that. We've paid our dues and we chose to have them. So one of the final points that I will make in this before I move on is we do have the federal government making these decisions. It will negatively impact Kentuckians. It is forcing the Kentucky legislation to make the cuts, not the federal government. They can say states can do whatever they want to do, and our state's going to have to make those tough decisions and receive the blame for it, unfortunately. So that's why I call it the buck passing, because yes, they can make the rules, but it's going to ultimately be the states that will reap the consequences and the angry parents as they have to navigate these systems and try to get the help. It's just a ripple effect. And we know that bias is there. We know that our workers in the cabinet for in that particular branch of our state government is overworked. You can suffer from compassion fatigue. You get tired of hearing everybody's story. It's a natural phenomenon that's been researched, and this is just adding to that. You can say that you're not going to do it, but the quality of service diminishes greatly for the families who have to go through the red tape in the system just to get the services that we want our children to have. And I also hear a lot of people on the pro-life platform, and that's wonderful. But what we're really saying when we cut these types of services to children, just as Katie was talking about and others in this group, is that we're pro-birth. We're not pro-quality of life at all, because we're cutting health care for children and we're making it harder for the people who are working to continue that and receive services. Thank you.
Thank you. Thank you so much. So I mean, just so many great points that you touched on, Rayana. I think one of the things, messages I really took from you is that, again, something that we kind of talked about a little bit throughout the day, there is already enough going on. Your caregiving, parenting, foster parenting, it's already a full-time job on top of the jobs that other folks, may be doing. And then now we want to add more red tape. Now we want to add more paperwork. And what, to your point, it's going to impact lives. This is literally going to take away from people. And one of our biggest worries is that people are going to fall through the cracks, and not be able to get that access to care, right? So, that passing the buck, I think, is a really great point too, right? Like, where is the accountability here? And who do we have to kind of keep putting pressure on, right? So thank you so much for sharing that. And uh, I I think as our final speaker, Theta, I want to transition to you quickly. And you're in a rural part of the state. Lots of Kentucky, most Kentucky is rural, right? And one of the things that a lot of us have touched on, I know Keith, you touched on it, Katie, you touched on, what is going to happen if we lose essential services? What if we lose providers, hospitals? How is it going to impact our communities? And that's a big worry when we're thinking about what the impacts of these cuts is going to look like directly on us. That means that we're going to have to drive. I know we've talked about transportation. Someone's going to have to drive who already doesn't have reliable transportation over an hour just to get basic services met. So Theta, I want to transition to you. You have a lot of expertise in a lot of areas, child welfare, but also being from a rural part of the state as well. What is this going to look like?
Wow. The first child welfare that I've been in for the past several years, working in and working with as far as an advocate goes, we've been trying to go upstream. We're trying an upstream approach. We're trying to be proactive, about what we do with children and families. So, that looks like we've been trying to remove barriers, make paperwork easier, make it normalize services and help. Help seeking. We want that to be normal, because these families, they deserve this. This is something not that they have to have every now and then. These they deserve to have. These are things that they need to raise their children. So looking at it from that standpoint, we're adding, the system is working against itself. We've been screaming, upstream, let's remove barriers. But now all of a sudden we're going to add those back. And so you've got two different parts of the government there. You've got Medicaid working against your children and families, where children and families have been screaming, this is what we're doing. We're going to go, we're going to go upstream with it. So, that looks like just total regression to me from where we're trying to go. In a rural area, like in my situation, when my son was removed, my husband had died in a logging accident, his dad. I needed grief counseling. I didn't really know what I needed, but I knew, at the time I needed something. But as far as finding a grief therapist anywhere near me in my rural area was an hour and a half drive. I had a 3-year-old son to take care of. I had life going on. I had a business to close out. There were so many things I had, that going through my mind, so many things on my plate. Driving an hour and a half to a therapist, was not one of them. So part of what I've been trying to do over the past several years is get providers, substance use providers, mental health providers closer to these rural areas in this, in this where they can help these people so they don't have to drive so far. So they do have an option. So they don't just push that care aside and say, "Yeah, I'm not going to fool with it today. I don't have time. It's too far. I can't do it. It's too much gas. I don't have a vehicle," that kind of thing. So again, we're going to lose providers. We're going to lose substance use, as he said. Many of them are already trying, are on the verge of shutting down now. Same thing, mine turned into using substances to self-medicate because I couldn't go to a therapist. So it's an evolving thing. It just unintended consequences that are just going to keep happening and happening to families. You look at rural areas and you think, okay, transportation is an issue, big issue in rural areas. And then they say, well, they've got internet. They can, send it in on the internet or upload it on the site. Well, that'd be fine and dandy. But we also have areas that are impacted, like Eastern Kentucky, that are still, after a couple years, still impacted by flood. They have damage. Some of them still living in tents. Some of them don't have homes. Internet access is not something that they have readily available in a lot of areas there. Also access to, again, no access to an office or maybe not transportation to get there. So again, right there's a problem. Mail for me, just general postage and mail. Where I live at in Western Kentucky, the sorting facility in Warren County had been shut down from the post office. So all of our mail now goes to Nashville. It's rerouted. Anything that I would get from Frankfurt or from an office was going to go to Nashville now before it ever comes to me. So you've got a time frame there that's going to lapse on those notices and things that they get, and they're shortening those time frames and saying you've got to recertify twice a year, you've got to do this. During COVID and thereafter, I know I lost benefits because the workers were already overworked, understaffed. I got a notice, sent the paperwork in, uploaded on the internet, but because of them being so busy, they didn't get it processed in time, so I lost benefits. Well, then that's a 3.5 hour phone call that I'm on hold waiting to get that straightened out. So we're looking at those same things happening again, and we're just putting more and more barriers on top of families that are already at their limit. They've met their max. One more thing is going to break them. One more thing is going to send them over the edge. I just don't see how we can keep doing this to families. I don't see how this is in any way, shape, form, or fashion right, or that this is going to help. And like she said, it's not a beautiful bill. There's nothing beautiful about it. It might be beautiful as they're going to get it pushed out their door. They don't have to deal with it anymore. But these are not just numbers. The facts and the numbers that you're giving are not just numbers. These are families. These are kids. My situation, my son was removed from my home. He was never reunified with me because I couldn't get the help that I needed. I do not want that to happen to any other family. I do not want them to go through that. So the question is, how do we stop it? We have to be vocal. We have to speak out. We have to let people know right now, this is not okay. These changes cannot go into effect, and it's not going to help our families. And all it's going to do is hurt Kentucky.
Thank you, Theta. One of the things I was thinking about when you were talking and just summing up one of the big messages I've heard from you all today is that these cuts are actually going to cost us more. Even if it's not just money, we're talking about lives, right? That's really just something that really stood out to me. And you all have a lot of experience and you have a lot of people who are going to be impacted and yourselves. And so I appreciate you all taking time and just sharing a lot of this perspective today. For the audience, before we head into our last question, and we're going to give our panelists about 1 minute each to respond, be thinking if you all have any questions, go ahead and start thinking about those and put them in the chat. And we'll have a few minutes here at the end to visit a couple of those. So while you all are doing that, panelists, I want to ask one kind of final wrap-up question, and that is, what is your message for policymakers? What is the message that you would send to them, and if you had a minute to tell them? And Aisha, I will start with you. Oh, is Aisha? She dropped off.
Again, we might have lost Aisha.
Okay.
We'll try to get her back on, but in the meantime, I think let's go to someone else.
Yeah, Keith.
I guess what I would say is that access to health and healthcare shouldn't be something that has to be negotiated at this point, and especially in one of the wealthiest countries in the world. It's just beyond me that it's wonderful we're meeting, and it's ridiculous that we're having to meet all at the same time. Um, you know, so I guess I would start, what I'm taking it away is that a lot of us on this call never planned on being in the position that we ended up in the first place. So I don't know, man. Like there's that separateness that we have, I guess, that we have to as a defense mechanism. When the truth is, like, I'm as connected to Tanya as I am to Rihanna, as I am to Theta and Katie, as I am to anybody else. And I think if we could focus on that connectivity between human beings, like I can't be okay unless others are okay. So hopefully we can shift to that in that direction. Yeah, that's it.
Thanks, Keith.
Mhm.
Tanya.
I tell you what, you know, y'all legislators, some of y'all know me. Y'all know who I am, I'm me. And I'm gonna say it like this. Look at it. Whoever is important to you, like for real, whoever is important to you, what if they was having to go through this? I know you cannot think about it that way because, oh, all my people rich, so they would never even have to struggle with this. But just go with me there for a minute and just really think. Anybody that's important to you, it ain't even got to be family, but whoever you count as a friend or anybody that is in your crew, if they had to go through this, you would not be okay with this. So see us as that. See us as that person. See us as that mentor or whoever is in your life and say, no, we need to fix this because this is unacceptable. It is not okay. And it is too many people being hurt. And I also want to say real quick, it ain't even just us that's gonna get hurt. I think that this is the part that we're missing is it's going to be clinics that are going to be hurt. It's going to be hospitals that are going to be hurt. Even big UK, and UK got some money, and even UK is going to get hurt. Like it is going to hit so hard that it's going to hurt everybody. It ain't just going to hurt the poor people. It's going to hurt middle class. It's going to hurt upper class. It's going to hurt every class. It ain't just the poor people, man. So I really think that they need to understand that it ain't just the poor people that it's going to hurt.
Thank you, Tanya. Appreciate it. Katie.
I guess just some final thoughts. I feel that, there's still a lot of barriers for the kids, but she is right. I agree with her on you know, we have to get people out there. We have to get them working. I get that. But we also need to make sure that in order when people start working, that we're still helping them and we're not just cutting off benefits too soon too. I did have a family one time, part of our home-based program. Mom was excited, got a job, got her benefits cut. She made more not working with her benefits than she did working. So we really need to look at how can we support families to get them to work. And like she was paying for bus pass, she had to pay a copay for her childcare. So the very important thing is to make sure that we're setting a family up to work and give them the tools to work to where, after, a certain amount of time they wean off of things, or maybe like that Medicaid program, maybe the kids get it and then the parents can get a discount or something. I don't know. I mean, I'm not a lawmaker, but we need to really look at, how it kind of weighs itself out to make sure that we're giving every family the opportunity to work and encourage that if that's what this bill is looking like. Besides, oh, well, you're working now, let's just rip this Band-Aid off and you can't afford anything now. That's not fair for the family either, because we need to make sure kids have the care they need. And we're not searching around to find a dental van to come in to meet that need or make sure they have like a home and somewhere they can go when there's something wrong, even for, medical's pretty good. I don't have any issues with that, but even like rural counties, things like that, try to make sure we have the workers, like connectors. They're probably going to get rid of them too. The connectors are someone I really use, like when the insurance drops, and they can go directly to that person and they can assist besides going to the office, the DCBS office, and waiting for hours, like like Rihanna said, hours on the phone. So definitely that connector is one that gets rid of that time frame because they can do, Medicaid, they can do food stamps, things like that for them versus having to sit on the phone. So just looking at all that, I know there's a lot of money out for those connectors. Ours in our Northern Kentucky area is wonderful. But yeah, if you guys need anything or questions, just you can reach out.
Thank you, Katie. Appreciate it. Rihanna.
I would just encourage to talk with constituents to find out what they are really facing and to fully prove this whole theory of fraud in more detail, and make sure I agree with Katie. We do believe that people should work. But we do need to provide the supports for them so that they can work. And the best people to tell you what those supports are the people who would be directly impacted by this. And so, one, listening to constituents and hearing their concerns, but also I'd like to extend an invitation if you want to know what life is like in living with an adult with special needs and having to provide that care. Feel free to reach out and you can come shadow me for a couple days, and we can even go through the Medicaid process together, and renew that so that you have an idea of how long it does take and all the information that is required. And I firmly believe that you have to walk in someone's shoes sometimes to fully understand. So go through the process yourself so that you can get an idea of the type of red tape that we're talking about.
Absolutely. Thank you so much. Aisha, we're just any last messages for policymakers in our audience today?
Yes. So, I mean, for the policymakers, pretty much what everyone else has already said, remember that constituents are more than just votes, they're people, and all of the decisions that you're making affect those people. And then for the audience, I want to encourage everyone to participate in discussions, participate in meetings, town hall meetings, write your legislators, email them, call them, get involved in coalitions and any advocacy groups. We are more powerful together. There really is strength in numbers. And even if you feel like your voice doesn't matter or won't make a difference, it absolutely will. I mean, um, not long ago, I was homeless, on the streets of Carter County, and and now I get to do things like this, and that's a blessing. But I'm not that special, and I feel like together we can get things done. So yeah, I just want to encourage everyone to participate.
Thank you so much, Aisha. Appreciate that. And last but not least, Theda, we'll end with you.
We are all, your senators, your representatives, everybody is one critical incident, one natural disaster, one life-threatening illness away in a bad situation from being in a situation that any of us could find ourselves in. That being said, we need to remember, again, these aren't numbers, these are people. They have children, they have families, they have homes, they have lives. You were put there for a reason as an elected official. You were put there to do what the public needs you to do, what they ask you to do, what your voters want. And today your voters are asking you, vote no. Vote no to this beautiful bill because there's nothing beautiful about it for the families of this state.
Thank you, Theda. And thank you all so much, our panelists, for a wonderful discussion and sharing your expertise and your stories today. We truly appreciate it. Thank you to everyone who attended our discussion today. If you all have any questions, please feel free to reach out to KVH. I know my email has been put in the chat, so you can reach out if you have questions or follow up for any of our panelists, and we'll be happy to do that. And then last but not least, we do want to know what you think about these proposed Medicaid changes, and how they're going to impact you, your family, and your community. So KVH is collecting public comments on both of the changes that have been proposed, and there's information that we will share and a link out after this meeting that will talk more about those changes. And we want to hear from you and what it's going to look like and your feedback. So be on the lookout for some follow-up information. Thank you all so much for joining us today, and everyone have a great rest of the week. Thank you, panelists.
Thank you all for joining us.